Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Welcome to The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. You can learn more about me and get connected at www.drshanibelgrave.com. I am grateful and excited to have on the show today Dr. Keyana Washington. Dr. Washington is a pediatrician and physician owner of Gwinnett Pediatrics and Adolescent Medicine. She's here to let us know what we should know about children's health from the pediatrician's perspective. Dr. Keyana Washington, thank you so much for joining the Coalition.
Oh, thank you for having me. I'm happy to be here.
Wonderful. So I already know this is going to be a very impactful episode. Can you please get us started by telling us a little bit about who you are and what you do?
Absolutely. Well, again, I'm Dr. Keyana Washington. I am a pediatrician and one of the physician owners of Gwinnett Pediatrics and Adolescent Medicine. Fun fact, we just celebrated 50 years recently. So our practice was the first pediatric practice in Gwinnett County, and we just celebrated our 50th anniversary. So I'm very happy and proud to be part of such an amazing group. I am a mother, a wife. I'm originally from Mississippi. At this point, I've been in the Atlanta area longer than I was there, but I still consider Mississippi to be my home and my roots. My husband and I have two beautiful children. Our son is 10 years old and in the 5th grade, and our daughter is 7 years old and in the 1st grade, though sometimes I think she thinks she's 17. So we have a very busy and active life between raising our children and just managing ourselves, our work, our marriage, our businesses. It's very busy. And one of the things that I love about being a pediatrician and sort of my passion is that I get it. Like, I get what parents are going through. And my goal is to help parents be the best version of themselves and help them to raise the best version of their children while not losing themselves in the process. So I am happy to be a partner in that parenting relationship.
That is wonderful. Congratulations on the significant milestone with your practice. A lot of children have been cared for and helped by your organization at the 50-year landmark. So that's amazing. Wonderful. So as a parent myself, I have a lot of questions too about children and children's health. So I'm excited to hear what you have to share. One thing that I'm always thinking about is cold and flu season. Mm-hmm. What can you tell parents about navigating cold and flu season?
I would say hold on to your hats. That's the best advice I can give. Cold and flu season, which when exactly it starts now, it's changed since COVID. I mean, I feel like it's getting pretty close to being year round now. But in general, right when school starts, is when we start to see it start a little bit, and then it picks up significantly September into October and goes all the way through March to April, which for us in Georgia, that's when allergy season starts. And allergy season is a bear. So when you're getting done with cold and flu season, but allergy season kicks up, and that's going to take you through June. So again, you only really have a few months off. What I try to tell parents is that it is a tough time, but it is manageable. And the main question parents have is, how can I keep my kids from getting sick? How can I keep them to where they don't get colds at all? You can't. You cannot. I wish you could. I wish I could figure that out for you and for my own children. But the thing to know is that most colds, most illnesses will pass on their own with supportive care, with just treating the symptoms. It's always a good idea to check in with your pediatrician if your child has had fever for longer than 2 days, or if their fever is very high and will not come down with Motrin or Tylenol or whatever anti-fever medications you're giving. And of course, if your child seems to be in distress, having trouble breathing, is not eating or drinking, so they're not producing urine, or is just acting very, very unusual, those are the times you want to check in with your pediatrician. But for the most part, just like our parents did for us, you lay on the couch, you take some Tylenol, you eat some chicken noodle soup or chicken broth, drink some fluids, and most kids will recover. It's the frequency, I think, that really gets parents worried, because typically a cold can last 7 to 10 days. And then you can get 2 to 3 colds a month. So really, that's 21 days out of a 21 to 24 days out of a 30-day period. You only have about 6 days off in that month, and that is just mind-blowing and exhausting.
So my follow-up question for that would be, when do children need to stay home? Is it only if they have a fever, or at what point would you say they need to not be going to school?
Yes, so definitely if they have fever, they need to stay home until they have been without fever for 24 hours without giving any fever medication. Okay, so that's important. If they have something that seems that could be very contagious, for example, if they are actively vomiting or having active diarrhea, then they should stay home until that has resolved, again, for 24 hours. And then for children who have more significant medical problems, such as asthma, if they are having a lot of issues with their asthma, shortness of breath, are needing breathing treatments very frequently, then they should probably stay home just so that they can be monitored, because those kids can tend to turn the corner really quickly. They go from being I'm okay to I'm not okay very quickly, and I would want them to be at home during that time period. Now, a lot of kids with asthma, once you kind of get over the initial hump, they'll still need some treatments, but it won't be nearly as frequent, and you can send them to school. But if you're having to really watch them and check their breathing rate and give them treatments more than every 4 hours, then they should be home.
Perfect. Thank you so much for that information. What should parents know about strep throat? Signs, symptoms, and sequelae?
Yes. So strep throat is a very common illness. It's a bacterial illness. Strep throat does need antibiotic. What I think the main thing that gets parents confused is that not every sore throat is strep throat. There are lots of viruses, especially circulating in our local community right now, that's causing very high fevers and sore throats, but those kids do not have strep throat. Really, the only way to know is to bring them in to your pediatrician or to your doctor's office to get them tested to see if they have strep throat. Because if they do, we absolutely want to put them on antibiotic for several reasons. The main reason being that it will treat the infection and help them to feel better. Within a couple of days, really, typically within about 48 hours, they start to feel significantly better from the strep throat. But also untreated strep throat in some children can lead to other more serious illnesses, more serious infections of the kidney or the heart. And so we need to treat the strep and get rid of that before it can cause those additional symptoms. But of course, I get patients in all the time when I say, what's going on? They say, we have strep throat. Okay, well, what symptoms do you have? Tell me what exactly is going on. And a lot of times that test comes back negative and it's a viral illness. And I have to explain how we don't need antibiotics for viruses. And we really want to try not to give antibiotics when we don't need them. For many reasons. And so bring your child in. If you think they have strep throat, absolutely bring them in, because strep throat is also very contagious. So we want to get your child treated so that they can get back to school without spreading it to others.
Perfect. Thank you very much. Another question is, when do children need to go to the doctor? So we're all familiar with the wellness visits, routine visits, but oftentimes you'll get a note, the child had a nurse visit today, complained of tummy ache, had pain in the leg, pain in the elbow. So how can parents kind of figure out what symptoms are normal or can just come and go with childhood versus when they really do need to be seen by their pediatrician?
Absolutely. So there's a few things that really need to be seen. If your child is having fever that's lasting longer than 2 days, 2 to 3 days, if it's an older child, I would bring them in. If they have had an acute injury, so fell off the monkey bars at school and arm is hurting and won't move the arm, then that probably does need to be checked out. Children can be quite resilient and still just kind of walking around with a mild fracture. So you want to get that kind of thing checked out. If you have a child with a chronic illness, such as asthma or sickle cell, and they are having complications or seem to be getting worse symptoms from that illness, then I would bring them in to be checked out. Now, my general rule as a mom is, my child went to the nurse and said, my stomach hurts, but you finished the day and now you're at home asking me what's for dinner. You're going to school tomorrow. We're not going to the doctor. Even if I wasn't a doctor, you're not going to the doctor. You don't need to go to the doctor for that. My head hurt, but I'm still running around playing and I want a Capri Sun. Okay, you're going to school tomorrow. So symptoms that are persistent or has your child acting abnormal for longer than just a few minutes to an hour or so, that would be something that I would consider going into the doctor for. The other thing to keep in mind is that many pediatricians, many pediatric practice, including ours, have good resources for parents where you can get questions answered or run something by us without actually coming in. So for example, if you get a call at 1:00 that your child, came to the office, said their stomach hurts, the nurse, let them lay down, put a cool towel on their head, and then send them back. You can call our office and say, I want to speak to a nurse, an advice nurse, and tell her what happened. And she will give you guidelines for, okay, so when you pick them up, these are the things you need to look for. These are the reasons you would need to call us back. These are the reasons why we would need to see him. So I know that many of my colleagues have those same types of resources. So don't ever feel like you're in it alone. Like, we don't want you to feel alone. We want you to ask us questions. We know that it's a lot to get off of work, get your kid out of school, come to the office, wait in the waiting room, wait for the doctor, come talk to us first and say, oh, he's fine. And you took all of that time off of work. So don't feel shy about reaching out to your pediatrician and asking, is this something I need to be seen for? Or is this something that I can watch? And do I need to watch them at home, or can I send them to school?
All good tips. Because that was something I dealt with when the children were infants, was taking them to the emergency room sometimes because I just didn't want to miss anything. And then realizing certain things you can kind of wait, watch, monitor. And
don't feel alone in that. I mean, even for me, I'm a whole pediatrician, and there was a point where I was sitting looking at my daughter coughing and breathing. I was like, So I took a video and I sent it to my colleague who's a pediatrician. I said, what do you think about this? She's like, I think I need to see her. So, okay, yes. We're on our way.
Yes, absolutely. Because we got to make sure they're good.
Exactly.
So, Dr. Washington, RSV in croup. Please educate us. What is RSV? What is croup? And the seasons, when do those illnesses arise?
Absolutely. So we are currently entering into RSV season right now. So RSV stands for respiratory syncytial virus. It's a long name, but it's a type of cold virus. RSV can infect anyone, and it often does every year, infects lots of people every year. For adults like us, older teens, older children who don't have any underlying medical problems, it would likely cause a cold. You get a runny nose, a stuffy nose, a cough. You might feel a little off. Sometimes you get some mild fever, but most of the time, older children and adults just have a cold and they're able to go along with their day. But they are very contagious. Their secretions are contagious. Their sneezes are contagious. Even talking, the droplets that come out of your mouth when you're talking are very contagious and have a lot of the virus RSV in them. And so if you are around an infant, particularly a child under the age of 2, and they contract RSV, then they can become very sick. For infants, for all of us, it produces a lot of mucus, but for infants, it produces so much mucus that builds up in the nose and can build up in the lungs. It can make it very difficult for them to breathe. And RSV is the number one cause of hospitalization for children under the age of 1 year. And those children have to go into the hospital for breathing support because they just can't breathe. There's no specific medication. There's no antiviral medication to treat RSV once you have it. You just treat the symptoms. So again, for us, we might take some cold medicine. For a baby, you'll have to just be constantly sucking out the mucus to try to keep their airway clear and keeping an eye on their fever, their feeding, and their breathing. Because if any of those are persistently out of whack, you absolutely need to go see your pediatrician. The RSV season for those of us in the Atlanta area in Georgia typically goes from October to March. And so we are just now starting to see kids present with RSV and test positive for RSV. While there is no medical specific treatment for that virus, there are preventive options available. Because the virus is so impactful on infants, there's 2 ways that infants can be protected. If their mother receives an RSV vaccine during the last trimester of her pregnancy, when she receives that vaccine, she produces antibodies that will fight off the virus, and she passes those antibodies on to her baby before the baby is born. And we have evidence that those antibodies actually last a while, so they can protect the baby for their first 6 to 8 months of life. The alternative would be for the baby to receive a shot of the antibodies, and then that can go into their body and help protect them against the virus. And again, that's typically given between the months of October and March. So I absolutely recommend for families, if you have young children, to, especially babies, to talk to your pediatrician about getting that for them. It's one of the biggest advancements in medicine for children to help decrease their hospital stays.
You said that's a new advancement.
Yes. So the vaccine and the antibody medication became available last year during the last RSV season. And it was so popular and so well received that the company actually ran out. They ran out. But this year they have their supply chain intact, and it is more readily available across many pediatric offices.
Wonderful. Well, that is good to know. So then what about croup?
So croup is very interesting. So croup is not a specific virus or bacteria. Croup is actually a symptom of an illness. So basically, croup refers to swelling of the upper airway that can happen when someone is infected, typically with a respiratory virus. That virus could be RSV, it could be flu. We saw a lot of croup when with children with COVID. It could be the common cold virus, it could be adenovirus, it could be any number of viruses that you can infect you, cause cold symptoms, but also causes lots of mucus production and swelling of the airway, the upper airway particularly. And so if you think about it, when your airway goes from, a pipe this large to a pipe this small, and air is going through there as you're trying to breathe, it can make a very distinct barky sound. So the cough can sound very barky, like a dog, like a chihuahua, or like a seal. And sometimes those children, they have so much swelling of the airway that they can make a distinctive sound even when they're just breathing in without coughing. And it sounds like a very tight whistle in their throat as they're breathing in. And so croup itself is a symptom of some type of infection. And sometimes it needs to be treated with prescription medication. Sometimes it can just be treated with supportive care, suctioning the nose, using a humidifier, or doing what I like to call steamy showers, where you turn the shower hot and just let it run and steam up the bathroom. You go in your smallest bathroom, you houses these, not the big bathroom, the small bathroom, and let your child go in there with the door closed and just breathe in that steam. That decreases the swelling in the airway and helps to relieve the barky nature of the cough, as well as that tight breathing. But there are some children where that airway swelling progresses and they actually have difficulty breathing. Those children need to go to the emergency room, preferably a children's emergency room, so that they can be treated and be provided with respiratory support.
Key question for you, Dr. Washington, because I've heard this cough out and about. When you hear that cough, does that mean that the child is contagious at that time or not necessarily?
Not necessarily. So the airway swelling is it's a physical phenomenon. The child is considered contagious from the virus, and people typically are contagious with their virus when they have fever and for 24 hours after the fever. So if the fever has gone away and the child is otherwise doing okay, and they just have that characteristic sound to their cough, that does not necessarily mean that they're contagious. However, we always want to remind our kids to cover their coughs. Use your elbow, cover your cough, and then sanitize or wash your hands frequently.
Perfect. Well, that was amazing insight and information that I know is going to help a lot of parents. So thank you so much. The other thing I was going to talk about is some things that we all need to know about in terms of how much sleep do children need, and then screen time from a pediatrician's perspective. How much should kids be sleeping?
Yes, so the sleep varies by age, of course. I'll start with the teenagers because I often get parents bringing their teens in saying that something's wrong. They're sleeping too much. They want to sleep for 10 to 12 hours. That's actually normal. So teenagers and newborns, infants, they're pretty much the same. They need 10 to 12 hours of sleep. The newborns can get that. They don't get it all at the same time, though. We would love if they did, but they will not. The teenagers often have struggle with getting that in because of their schedule, because of school, because of their activities, and because of their body's natural circadian rhythm. Typically, teenagers naturally are night owls, and their body naturally wants to be more awake for longer at night and to sleep later in the morning. Of course, their school schedule does not allow that. And so they are kind of constantly running behind the ball, trying to catch up on their sleep. When you go up to like your preschoolers, they still need a good amount of sleep. I aim for about 10 hours. And then for our school age children, elementary school, middle school, I aim for about 8 to 10 hours. Most children do not get that much sleep, but that is what is recommended and what would help them perform at their best overall. I'm glad that you mentioned screen time because that often interferes with our sleep, with our kids' sleep, with our sleep as well as adults. You go lay in the bed, you're like, okay, I'm going to go to bed. And then you pick up your phone, scrolling, and then an hour later, you're still not asleep. Kids are the same way. So under the age of 2, I encourage parents, don't do any screen time. They don't need it. Of course, sometimes, parents, it's part of our lives now, but I don't want our babies, our infants, our kids under the age of 2 learning their language from a screen. I want them learning it from a person. I want them to be able to do the back and forth. You have that conversation with your baby so that they can learn the back and forth. You do not get that back and forth feedback from a screen. So I really try to very much limit screen time for kids under the age of 2, from about 2 to 5, 1 to 2 hours of high quality screen time, which means you need to know what your children are watching. I do not recommend giving your child an iPad and sending them to another room and letting them just do what they would do, even on supposed healthy sites like YouTube Kids, or where you've put in, barriers or whatever they say you can put in to protect the kids, something can always get through. So I say that if our young ones are going to be watching iPad, we have this technology now where you can cast it to the television. Everybody's going to watch it. If little Jimmy is watching, Paw Patrol, we are all watching Paw Patrol. So we all need to know what he's watching, what he's learning about. And that can give you something to talk about when it's dinner time, and the screens are turned off. So screens need to be turned off at mealtime. We don't need our iPads and our phones at the dinner table. We don't need the television on, looking at the TV while we're, eating. We need to turn that off. We need to have conversations with each other. Talk about that Paw Patrol episode. What did you learn? What would you have done if you were Rubble? And kids love that. They love to be able to interact with you, tell you about their day, tell you what they're thinking. And doing too much screen time just tends to get in the way of that. As our kids get older, of course, they will be introduced to screens more. They use laptops at school. Some schools use tablets. They send them home. That's all fine and well. And they may do additional screen time for leisure at home. But again, I really strongly believe you need to know what your kids are watching. You need to be able to hear it. Sometimes I've had my child watching something and then I was like, wait, what did he say? Wait, turn that off. Let's talk about what he just said. Let's talk about it. And you have a conversation with your child rather than just turn that off and go to your room. No, let's talk about, what did he say? What does that mean? What do you think it means? Why do we not want to say that? Is that appropriate to say? Maybe it's appropriate in this context, but not in another context. You can't say that at school or things like that. There can be a way to have a conversation with your child, but you need to know what your child is watching, what they are playing, and you need to set some guidelines. I am very much in line with no child needs to have screens in their room. They don't need their own computer in their room. They don't need their own iPad in their room, because when it's time to go to sleep, it's time to go to sleep. I have my phone in my room and it is disruptive. It's much better for me to not have that on my nightstand. So I don't want that for my child, especially when they're in elementary and middle school. And to be frank, I have had many children, a good proportion of children who have struggled with depression, anxiety, suicidal thoughts, particularly in middle school and high school. And when we really would like to talk about it, for some of those children who have actually made attempts or have threatened to do something harmful to themselves, a lot of times it was something that they saw on social media, on their phone, on their iPad in the middle of the night. Mom and dad are sleeping. They were up, they were looking at it. Something upset them. They felt alone. They didn't know what to do, and they made a rash decision. There's no need for that. You don't need to. There's nothing that important going on the internet at 1:00 in the morning where you need to have your phone or your iPad with you. So I really encourage parents to really think about that and set some serious and consistent boundaries when it comes to that.
Well, thank you so much for sharing your perspective as both a parent and a pediatrician, because we want to keep our children safe and we want them to thrive and to grow up to be the best version of themselves. So anything that we can do in childhood to set them up for success is what we want to do. Final question, Dr. Keyana Washington. So obesity in this country is an epidemic. Children also are dealing with obesity. From the perspective of a pediatrician, what tips do you have for parents to help combat childhood obesity?
Absolutely. It is. You're absolutely right. It's an epidemic among adults, among teens, among children. It's a systematic problem in our country, and there's a lot of work that needs to be done from a systematic standpoint. But when you're talking about one-on-one in the family unit, I tell parents that we just want to try to make the best decision, the healthiest decision we can, and think about those decisions day by day. So a lot of things, Our schedules are so busy now. Kids are so busy. They have so many things to do, and it can be very convenient and sometimes necessary to go through a drive-through. I don't make my parents feel bad about having to go through a drive-through. If you're, it's 9 o'clock at night, we haven't eaten, we need to eat something, that's fine. But we can make healthy decisions in the drive-through. We can choose to get water instead of sodas, instead of sugary drinks. We can choose to get a side of fruit instead of French fries. We can make sure that our children are eating a kid's meal instead of an adult meal when we're going to these restaurants and these drive-thrus. So making those kinds of decisions, but really trying to think about ways we can fit healthy choices into our lifestyle, and just thinking about strategies. I don't want to make parenting any harder than it has to be. I find that I can make much better decisions in the grocery store than I can at home at 5 o'clock when everybody's starving and I need to get something on the table. So if in the grocery store, I decide we're going to go down this frozen food aisle and get lots of frozen vegetables that I can throw in the microwave and steam up, and we're going to go on the produce aisle and get lots of fresh fruits and vegetables, and we're going to go around the perimeter of the store and get some lean meats and some lean turkey and some chicken that I can cook up fairly quickly. And we're going to not go down the chips aisle, the cookie aisle, the soda aisle. We just are not going down those aisles. Or I'm going to sit in the comfort of my own home and place a Kroger pickup order, so I don't even have to be tempted by those aisles. And they can package that up for me, and I go to pick that up. I can make a much better decision then than I can when I'm standing in the kitchen and the kids are running around and hungry and just got home from work, and all everyone wants is a bag of chips and some cookies because we're all starving. So just trying to make those decisions and just thinking about ways to incorporate sort of guidelines for your life. We need to have one fruit and one vegetable at least every day. And my mantra is, if you give your child one vegetable, they're not going to eat that. If you put one vegetable on their plate, they're not going to eat that. If you put 3 vegetables on their plate, they might eat 1.5. So if you give them some choices, then that you may be able to get something healthy in them. But make it non-negotiable. We're having this healthy meal. This is what we are all having, and this is what we're having today. Another thing that I use in my home, and I've recommended to some of my parents, and they've come back and say they really like it. Kids like treats. And as parents, we want to give our kids the world. We want them to be happy. But we don't need treats every day. So we do dessert days. On Sundays and Wednesdays are dessert days. You can have a dessert on Sunday, and you can have a dessert on Wednesday. Now, my kids know this. This has been the rule in our house for a very long time. They still ask me on Monday, Tuesday, Thursday, Friday, and Saturday, can I have dessert? And it makes it so much easier for me as a parent to be able to say, is today a dessert day? No, then no, we're not getting a dessert. Rather than thinking in my head, do we deserve a dessert? Should I give them a dessert? What else have they had today? Did we have dessert yesterday? I don't have to do all of that calculating and remembering. Is it Sunday? Is it Wednesday? If it's not, then we're not having a dessert. You can have some fruit and some water, and we're keeping it moving. And so doing things like that can make it easier. And then the last thing I would say would be physical activity.
Yes.
We absolutely, and there are some families who are so good about it, like they have their kids in all of these sports and activities because their kids are interested in it. And some kids just really aren't interested. In the time when it becomes a real issue, I find there's something that happens in 5th grade, 4th to 5th grade, and then going into middle school when they don't even have recess anymore. The physical activity for a lot of these kids just plummets. Particularly my girls, I'll be honest about that. Like that's when the girls just kind of stop. If they aren't actively involved in the sport, they just kind of stop. And so we have to make that part of the family routine. We are all going to go out for a walk for 20 minutes after dinner or before dinner. If it's cold, we're going to put on jackets. If it's raining, maybe we'll stay inside and do some exercise, but we're going to do something every day to get moving. And I think that's really, really important. It can tie in with the screen time. It's time to take a break from the screen. I just told my daughter 2 hours before I got on this, it's time to take a break from the screen. Well, what am I going to do? I'm so bored. Well, let's go for a walk. Let's get outside, get some sunshine, get some fresh air. You're not on the screens. We're moving our bodies. That's a great time for us to talk, talk about your day. But getting some physical activity is going to be very important. And we just want to teach our kids how to build a healthy lifestyle for themselves now so that they don't struggle with it so much when they get older.
Dr. Washington, I love that. I'm totally going to snag that Wednesday, Sunday dessert thing.
Yes.
I'm totally enacting that this week. So I want to thank you so much for joining the coalition. That was phenomenal. You have an open invitation. I'd love to have you back because there's so much more that we can learn about children's health.
Absolutely. Anytime.
So Dr. Washington, for folks watching who maybe need a pediatrician, what is the best way for people to get in contact with you?
Sure. So you can look at my practice website. It's www.gwinnettpeds.com. And so we have 4 locations in Gwinnett County. We're in Duluth, Lawrenceville, Hamilton Mill, and Sugar Hill. Our office phone number is 770-995-0823. You can also find me on Facebook, Dr. Keyana Washington on Facebook.
Fabulous. Thank you so much, Dr. Washington. We'll see you next time.
See you next time.
All right, everybody. Thank you so much for tuning in to another impactful episode of the Coalition. Today, we focused on children's health. Very special thank you to Dr. Keyana Washington. She's an awesome pediatrician, and I'm grateful that she was here today to share her expertise. You can stay connected with me at www.drshanibelgrave.com. You can get connected with Dr. Keyana Washington on Facebook. You can also visit the practice website, www.gwinnettpeds.com. Thanks, everybody, for watching. Make sure that you share this episode with family and friends. I'll see y'all next time.